Greetings to all, and thank you for having taken time out of your busy schedules to be with me here today. My name is John Marty, and today I will be delving into the plant formerly known as St. John's wort. On a practical basis, this flowering weed has been utilized for over 2,000 years, and studies upon its beneficial nature are quite extensive. Because of this, it has become quite popular in countries such as Germany by means of use in medical practice. Scientifically known as Hypericum perforatum, the plant has been linked with various medical uses. It has accounted to having benefits with mood alleviation, smoking cessation, memory, and poses anti-inflammatory and antibacterial properties. Its use has been encountered with the hepatic cytochrome P450 system, which will be further discussed later in the presentation. The primary use of St. John's wort has been admired in treating depression. Depressive disorders are currently a burden worldwide, where there are over 350 million cases of individuals presenting with this condition. Studies have been implemented utilizing patients across varied scales of depression. They have been conducted against standard antidepressants and placebo trials. Various literature, such as Brenner and colleagues, suggests that St. John's wort extract may be a safe and effective alternative for the treatment of mild to moderate depression. However, it has questionable efficacy in major depressive disorders. The flowering weed has portrayed equivalent nature to that of the placebo in multiple trials. St. John's wort has been addressed prominently through its ability to moderate mood and help in the reduction of anxiety, yet studies show it can perform antibacterial activity. These properties have been associated to the ingredient embedded within the plant known as hyperforin. It can be suggested that the plant is a cost-effective alternative to the treatment of wounds and various skin conditions. Similarly, extracts have been synthesized into drug forms for use as an antiviral agent, seen for treatment of herpes and influenza. To add to its promising nature, Hypericum perforatum has been linked to alleviating memory fatigue in middle-aged rats. It is deemed an effective treatment in preventing forgetting behaviors. St. John's wort has been affiliated with the treatment of premenstrual dysphoric disorder. The symptoms associated with the condition reflect individual suffering and declined moods. Initial treatments installed were to administer patients with standard antidepressants. However, Hypericum perforatum has proposed itself a promising alternative with reduced side effects. Smoking is currently a worldwide epidemic shared amongst a large percentile of the population. In treating the addiction, various medications have been synthesized, such as nicotine sprays, patches, and gums. In the worst of scenarios, bupropion, a prescribed medication, has been a solution to the cessation of nicotine. Fortunately enough, Vance and colleagues have identified that St. John's wort shares a similar cascade of effect to bupropion, where dopamine, noradrenaline, and serotonin circuitries are influenced. The potential for the use of the plant is promising, as side effects such as headaches experienced with prescribed medication are reduced in Hypericum perforatum trials. A brief and simple background on the cytochrome P450 hepatic enzymatic system is that it is involved in the breaking down of everything ingested from the bloodstream. The question now is, how is this linked with St. John's wort? The issue at hand is that the herbal extract has been identified to induce the cytochrome P450 cascade. Markowitz's study has shown a heightened excretion rate of drug metabolism and dramatic reductions of said drug in the plasma. Hence, there are dangers in coupling this phytomedicine with drugs that are imposed for treating cancer or even HIV. The National Cancer Institute identified a chemotherapeutic metabolite was seemingly ineffective when administered with a set dosage of Hypericum perforatum. To bring this all together, while St. John's wort has been a popular substituent to treating states of depression, its eligibility in becoming the medicine of choice is yet to be determined. Its proposed use for various conditions is arguably beneficial in spite of showing constructive properties of negating factors in cancer and HIV treatment. Hypericum perforatum, however, is indeed a promising phytomedicine, and as alliterated to above, has very promising features for the field of medical research. Thank you very much for your time.